Okay, I think we'll go ahead and get started. And I expect that there will be students continuing to filter in, if that's all right. Okay. On behalf of the George Washington University School of Nursing and Dean Johnson, who regrets that she couldn't be here this afternoon due to a Board of Trustees meeting, I wanted to welcome our distinguished guest and our speaker. First, let me introduce a distinguished guest that, in advance of our speaker, who I know personally very well. She is a professor emeriti at the University of Michigan. She has been very engaged in advanced practice and the documentation of data around the positive outcomes of APRN-provided care to patients. To demonstrate that it's comparable or better than what physicians provide. She has also, since her retirement a couple of years ago, been part of the board of directors for the Nursing Alliance for Quality Care, and also has been on the board of the Haitian Nursing Foundation, and now is the president-elect of the Haitian Nursing Foundation. And so I'd like you to welcome Dr. Joanne Hole. I'd also like to ask those of you who, as students, staff, or faculty, because I think we have all three in the room, who have been to Haiti as part of one of our medical missions. Can you please raise your hand if you've been to Haiti? Thank you. And so I would urge you to certainly come up and talk to our speaker afterward to let her know that you've been part of that experience and what that's meant to you. And so now, without further ado, I'd like to introduce our speaker, who's going to speak on transforming healthcare in Haiti, one nurse at a time. This is Hilda Alcindor. She is the Dean of the Faculty of Nursing Science of the Episcopal University of Haiti, which admitted its first students in January of 2005. Dean Alcindor is fluent in English, French, Spanish, and Creole. So I know some of you speak one or more of those languages besides English, so you may feel free. Certainly we're beyond my capacity here. She was appointed dean in October of 2004 and has been instrumental in implementing the plans for the university. She's a strong, dynamic leader of the School of Nursing, and I think that Haitians are very lucky to have you. Dean Alcindor has been active in the Haitian American Nurses Association as a member and elected officer. She is also a member of the American Nurses Association and of the Florida Nurses Association. She was selected as an American Academy of Nursing Fellow in 2013, last year, which is a huge honor. Dean Alcindor has also worked in several professional positions in the Miami area, including hospitals, home health, intensive care, recovery room, emergency room, and as a school health educator. So she comes by her vast array of knowledge, which she applies to this community and by doing it the hard way. Her most recent position was an admitting nurse and coordinator relief nursing supervisor for the Mount Sinai Medical Center in Miami Beach. So without further ado, let me welcome Dean Alcindor to talk to you today.
Well, I just flew from Haiti yesterday, and before I went to Haiti, I was here in this country for 30 years. And today, I'm not going to give all the statistics about Haiti, about the professional workers, healthcare workers in Haiti. I'm going to present la Faculté des Sciences Infirmières de Léogane, and that means nursing school. We like to say it in French, that makes us more sophisticated. On the screen, you see Université Épiscopale d'Haïti, c'est Episcopal University of Haiti. Faculté des Sciences Infirmières de Léogane is the nursing school for the Episcopal University of Haiti. Now, this is our school. this is previously. We have more things added since that picture was taken. We just had a Bueno auditorium. Right now we have a guest house, so we do have hot water, and we have hot water. We have air condition in the guest house. It will not show, but we'll continue. The nursing school is affiliated, as you know, as I just told you, to the university, and is the only nursing school offering a baccalaureate program in Haiti. When I went back to Haiti in 2004, it was like a joke to 4 years of nursing school, because all the schools were 3 years, a diploma school. And even the people working at the Ministry of Health of Haiti told me that it was not appropriate for Haiti. But as of this year, they ask the Ministry of Health wants all the nursing school to be 4 years. They do not have a baccalaureate program as the curriculum should be, but they're getting there. So that's progress for Haiti. This is the mission of the of FSIL. Share the commitment of the Episcopal University of Haiti based on teaching, research, service, and its recognition of the power of the Christian message. Everything it does is not she does. Its mission is to provide a program of professional studies in nursing, incorporating the principles and practices of public health to prepare its graduate to effective healthcare as clinicians, leaders, and agents of change. The program provides its graduates with theoretical and clinical skills necessary for a good training. However, graduates will develop a passion for the ethical practice of nursing as a science with compassion. Our vision, because it's the school, is part of the Episcopal University of Haiti, so the program is an expression of nursing as Ministry of Jesus Christ, where the spiritual dimension is an integral part, as well as teaching and administration of quality health care. FSIL offers also a post-baccalaureate education to meet the need of the professional nurses. In September 2013, we started the first family nurse practitioner program. That's the only master program in nursing in Haiti. The FSIL opened its door on January 10, 2005. And since then, we continue to grow. In January, the story behind that, in October, November, after I was appointed as a dean, and I didn't know anything about being a dean of a nursing school. I know how to be a great nurse. I am a wonderful nurse, but a dean, that's another story. So they said, and Wood Bernard said I could do it. She insisted. Dr. Wood Bernard is an emeritus professor of University of Michigan. After retirement, she was asked to lead the project of opening a nursing school in Haiti. But a vision for Haiti was a baccalaureate program. But the vision of the people of Haiti was an LPN school. She said, no, Haiti deserves better. So we talk about it. I said, well, I don't know how to be a dean. She said, I know you can do it. You're going to do it. Okay, when Wood Bernard say you're gonna do it, you're gonna do it. So that's and they gave me in November, they give me the keys and a building. Say, okay, in January we want a school. We want students in January. So with the help of my friends, I get to do the entrance exam, and on January 10, 2005, we had 36 students at the school. So we started. And since then, we have graduated 6 classes from 2009 to 2013, a total of, it's not 80 or 84 nurses. And I want to report, and this is the pride for me, is 90% of those nurses are still in Haiti. because as I came here, all nurses graduated from the developing countries. The goal is to come to United States to go to Canada. But we have a trick to this. The students, this is a private school, they cannot pay, they can pay low bit of the tuition, they can't pay too much. So we give them a scholarship, they sign with us. After graduation, they have to stay in Haiti for 24 months. So the 24 months, since we graduated the first class in 2009, so far in my research, we only lost 3 people. 3 people came to this country, and I'm very proud of myself. I don't know how I kept them in Haiti, but they are. This is our first graduation class, and I like to show those pictures. It's my proud it's showing them. And this is the second class. It was in 2009 or so. This is the third. This is in 2010.
Show them Ruth was in that last picture.
Okay, this
when you talked about the formidable.
Yeah, the when you can say no to Ruth Bernard. She's with the black top. That's her. And this is the classes to 11 to 12, and this is the last commencement in 2013, and we. In Haiti, we are probably the only school that graduate very small amount of nurses. Every school, they have 100 students there. We believe in quality, not in quantity. We don't graduate many nurses, but we try to give to prepare the best nurses for the island. On September 26th, 2013, there was really a day of celebration as we had the first master program started at the FSIL. It was 19 students that are starting the FNP program. And the program is offered with the help of PHH, Promoting Health for Haiti. So this organization is a group of PhD prepared nurses. Dr. Carol Roy, Dr. Carmel Bellefleur, they started PHH, and they're working with us for the FNP program. And here we have the FNP nurses with me, and it was somebody. The guy next to me is the dean. The dean of I think the agronomy school of the university. Episcopal University, and the Evans is the clown standing next to me. He's a nurse. Also, we had the visit of the First Lady of Haiti who came to visit us. For the student, and today I just visited your simulation rooms, I would say. And us, we use the hospital. We do have a skill lab at the school. We use Leogan. In Leogan, we have 3 places where we go. We go to Grecier, that's another small town near Leogan. We go to Petit Guave. We go to Port-au-Prince, to Cape Haitian, to get as much clinical as we can get. Those are the students at work. There were the first one in the left, she's at Sainte Croix. The one, I think, they're all at Sainte Croix. I think there's some, here there's from Milo, from the Cape Haitian. They are a Cape Haitian. The top is the peds, and in the bottom there, I think they're working on a med-surg patient. And again, we, at FSIL, we really love education, patient education, health education. As now we have a weekly radio program in Leogan. Every week, if not weekly, daily, daily, 10 to 11, the students of FSIL go to the radio and do health education. As I went through the lab, the community There you were talking about Ebola. I'm sure they were this morning talking about Ebola at the radio. And the radio has a good audience, and they send questions to texting. And in Haiti, everybody has a phone. Some of us cannot eat, but all of us have a telephone. So it is a Haiti. We don't understand it. We don't ask questions. Sometimes I wonder how they survive with those telephones, because you gotta put money to talk. It's not like here you pay a fee a month and then that goes. No, if they have to put money, they're always on the telephone. They do texting, they do all kind of stuff. So, but everybody has a telephone, and we use that for the radio show. They text us, ask us questions, because we don't open the lines, because we feel like we need to communicate with the community. The faculty members of FSIL, they were at Jackson Memorial having an immersion program. What I'm trying to do is to have our faculty, our students, come in to United States, see the way nursing care is rendered here, then they can go back to Haiti and work with the model. And it's been fine. After this immersion at Jackson Memorial, I see a lot of changes with the faculty, the way they practice now. Again, they were proud to have a certificate from Jackson Memorial in Miami. There again, they were again at Jackson Memorial. I talk about the radio show and the community work. We involve in the community. We provide health education to the community of Leogane. We're sending students to mobile clinic to help with the mission team. Our goal is to have collaboration with many teams, medical team, surgical team come into Haiti. The students, I have to say, at FSIL, we teach English in all 4 years. So all 4 years of the program. So by the time the students are seniors, they fluent in English. So they can be the translators for the medical team. That's what they do when they go around Haiti helping. We have the weekly radio show. We have an annual health fair for the children of Leogane. That day, FSIL provides consultation, medication, a hot plate for the children, and a Christmas gift. And that's the best day for me to see the faces of those students. And I have to tell you, that little toy, whether it's a little car or a doll, that's the only gift they can afford. The parents cannot afford gifts. And in the next slide, you'll see what the students do with this. Here, combing hair, bathing them. And we have, I like this one, with brushing the teeth, because they come, we teach them. In the meantime, we try to teach them how to brush the teeth. And then we have all those clothes, give them new clothes. Probably that's the only new clothes for the Christmas time. And then there's the medication. We had a doctor here working with us to see the patient, because they do have a peds consultation for the day. They're at the Christmas, that's the story. They very, very happy to stand at the Christmas tree and take a picture. And basically what we're saying on that slide, those slides, is just say, we need the help of students, faculty, to give care to the Haitian people. I think Haitian people deserve health like everybody else. And Haiti does not have a lack of nurses. We do have nurses. Do we have good nurses? That's the question. Because right now, we have 40 nursing schools accredited, recognized by the Ministry of Health. That's the entity that regulates nursing in Haiti. So do you have 40 of them? We have probably another 100 nursing schools in Haiti. So there's plenty of nursing school. But the bad thing though, we're making nurses for Canada and United States. Those 40 nurses, 40 schools of nursing, They graduate nursing because Haiti is part of ICN. When a nurse comes from Haiti to come here, they have to take the TOEFL. If they pass it, they go take the state board and they get the license and they work. A nurse in Haiti makes about between $300 and $500 a month. When they get here, people tell them, okay, this is what you can make, even as a nurse's aide, what you can make here. So that's why they flew the country. But our mission at FSI is to keep good nurses, to give quality healthcare to the people of Haiti, because we have all kind of communicable diseases. We are. I don't want to say we are poor. We're not poor because we have people. As long as there are people on the land, we have. We're not poor. We can always go to be better, but we need the help of the American people. I say we need the help of the American nurses, because in 1915, when America went to Haiti to occupy Haiti from 1915 to 1934, and America starts the first nursing school in Haiti, the nursing school in Port-au-Prince, the national school. So you started nursing school in Haiti. Haiti didn't ask you to start a school. So you're going to continue to make, and you're going to continue to help us develop nursing in Haiti. When I went back, I went to nursing school in Haiti. I graduated in 1971. When I went back in 2004, nothing changed from the time I was there. But we need to change that. And with your help, I know we can change it, because I already see the changes. The way the nurses coming from FSIL administer care. They're doing it with another level. They're agent of change. It's not a joke. They are leaders. And we have them in different places working as leaders, and they can do it. And Haitian people, Haitian nurses can learn how to be great leaders in healthcare. We're not going to continue to say we poor, the poorest country in the hemisphere, and then just keep our hand like that. No. Haiti is a big, wide open wound. We need to take care of it as nurses. We need to nurture it. No Band-Aid. We don't want Band-Aid. When a mission goes to Haiti, give care for a week, you put in Band-Aid. We need more a sustainable program to take care of people. When we take care of diabetes, you cannot take care of a chronic disease one day. You need to have assessment. You need to have people follow up on those patients. But when you come 1 week, you go home, then what? Do you know that medication you give to blood pressure didn't work? How do you know? When you go back 6 months later or 4 months later, how do you know? By that time, this patient probably died. The life expectancy in Haiti, I'm being generous to Haiti, it's about 60. I'm already past that age. See, I'm a survival of the Haitian life expectancy. We die fast. And right now, if every five people you meet, one of them is diabetic. And if you look back in the way we eat for what we do, that's normal to have diabetes. There's a lot of diabetes, a lot of hypertension, and one of the largest problems in Haiti now is stroke. Stroke. You have stroke because of hypertension and other things. And because even with the Band-Aid helps the stroke, because the people taking all kind of medication, they don't even know what they're taking. And then you have people with stroke, nobody taking care of them. We need, we were talking at FSIL to have a program for physical therapy, because after stroke, nothing's done. Those people stay home, there's no exercises. Even after the earthquake, the FSIL shows to the world that we doing it another way. Earthquake happened January 12, 2010 at 5 minutes to 5. And at 5:20, we had our first victim from the earthquake. He was a 1.5-year child, lifeless, they brought to us. And thank God for FSIL, we have CPR. And the student did CPR. That child is alive today because of us. And from that child, we had so many people come into the yard of the school. We saw 16,000 people in the yard of the school in the course of 5 months. 600 surgeries were done at the school. The school became a hospital overnight with 3 operating rooms. Guess who worked in those operating rooms? Those students. And the night of the earthquake, they were splinting, they putting IVs. I was the only nurse there with a bunch of students. Some of them couldn't do anything because they were too shocked to work. But at first, when they had so many people coming, and I looked at them, I said, they're all on the floor crying, and for good reason. They're not from Leogane. Some of them from Cape Haitian, St. Regina, Jeremy. They don't know what's happening in the country. So they were crying. They're on the yard. And I look, I say, God, Hilda, what do you do? I can take care of all those people. So I turn around, I say, you know what? I didn't ask you to come to nursing school. You want to be a nurse? Just get up and get to work. We have patients. We can be crying. So everybody was doing get up, and they started working. So this is what FCL is all about. And that night, they used all the brain or whatever they had as gray matter. We used all the sheets from the skill lab to stop bleeding, to splint. Every box we had, we cut it to splint. So the next day, I went to get water. We didn't have any water. I took my truck, get to somewhere to get water so we can wash wounds. And then the students started suturing, because in Haiti, one thing student nurses must learn, they have to know how to suture. They have to know how to deliver babies, because this is a country where you don't have doctors. You have 1.7 doctor for 10,000 inhabitants. So nurses has a great role to play, but they cannot play that role if they're subservient. If they say yes sir to the doctor, yes sir to the doctor, waiting for the doctor to give the orders, no. Nurses gotta to play the role of really a health professional. Right now, all the nurses in Haiti working, wherever they work, by default, they work as nurse practitioner, because there's no doctors. That one doctor is in Port-au-Prince, in the capital city. You've been to Haiti. When you went to Thomond, you went to Cape Haitian. You might see some doctors there in Cape Haitian, but for how many people in Cape Haitian to have that handful of doctors? Some of the specialty we don't even have. Or if we have, it's so scarce. We have 3 oncologists in Haiti. 10 to 11 million people. 3 oncologists. All 3 of them in Port-au-Prince. We had about 50 anesthesiologists for the country. We have ophthalmology because of diabetes. We talk about diabetes as a chronic disease, and we know as complication is eyes. We have probably 30 to 50, I don't know how many exactly, for ophthalmology. And right now, the nurses from FSI are working with an ophthalmology to see if they can create some type of nurses. They won't be optometrists, but they can do a visual acuity and get those people ready to have a cataract or glaucoma surgery done. So we are in dire needs of health. Health in Haiti is very crucial. And the government now is talking about education. Indeed, we have to educate our people. That's important. But can you be educated if you're sick? Nope. A student, you can send all the students to school, but if they cannot see, if they cannot hear, if they're full of worms, if they're anemic because of the worms, if they're anemic because of malaria, can they learn? So we need to put health in another level, and that level where health needs to go depends on nursing care, because as you know it, nursing is the backbone of healthcare. Without nurses, there's no healthcare, and that healthcare it's not just nurses. We need good nurses to provide good quality healthcare to the people of Haiti. Thank you very much. If you have any questions.
So I think, yes, please
Yeah,
feel
go
free to
ahead.
do that.
Go ahead.
I had some questions. One of my questions was about, since you don't have so many doctors, what about medicine? What's your supply chain for medicine, and how do you, if you can't have doctors prescribing medicine, how do you handle the whole medicine?
Oh, they do have pharmaceutical in Haiti. I know two of them, the CATSE and Photolab. They do that. And a lot of medication come to the country from Dominican Republic or from the state.
So supply of medicine is not so much an issue?
I don't think so. Buying the medication is an issue.
Right.
Having the money to buy it is an issue. It's not as much as the supply.
You mentioned there were 40 accredited nursing schools, and then you said, there are other nursing schools?
Yeah, others
So
not accredited.
they're non-accredited nursing schools? And who operates them? Just private interests, or?
And unfortunately, I have to say, most of the nursing school in Haiti, the owners are doctors. So it's an industry. It's a way to make money. Because everybody, they know tomorrow they can come to this state, they can make money, and people are not well aware of the scam, so they go to nursing. So they have students, but most of them are doctors on.
Okay. And the accreditation is by who?
By the Ministry of Health.
By the Ministry of Health. And then to practice, do the nurses need to be from an accredited school or not?
Yeah, they have to be from an accredited school, but that depends on the same way somebody might have 2 rooms and it calls it a hospital. So are they going to worry about standards? No.
Right.
But the nurses in Haiti must be licensed, and the Ministry of Health offers or give a licensure exam once a year. So to practice, really, you have to be licensed.
Licensed by, and you have to be from an accredited school.
Absolutely.
So these non-accredited schools, where do those nurses go?
That's a good question. I don't know where they go.
Okay, thank you.
You mentioned you are the only bachelor degree program, so where your faculty there got their education?
My faculty from here.
Oh,
Not my, actually, we have faculty from here going to Haiti to teach for us.
oh, so they are just on like
But
a year
right
contract
now-
or something like that?
No, see, right now, as we in our 10th year, we have faculty come in from for the first class. They don't have a master yet, but they're working on it. They had a certificate education, a nursing education from Rutgers University, from Jersey, so that enabled them to work as teachers.
Yeah.
Yeah.
So the faculty at FSIL right now are all Haitian and graduated from FSIL. So they created and built their own faculty. Americans only go in, I think maybe had more input the first year or
Yes,
two, but
yeah.
only go in as asked or as needed. So it is not, these are not taught these classes are not taught by Americans in general. There might be pieces of them,
Yeah.
you know, that are, but I think that's the beautiful piece of this, that it is Haitian run and that it makes it so appropriate to Haiti.
Where is the school geographically located within the country?
Oh, unfortunately, I had another slide with the, with
Yeah.
my, where's the guy? I can put my other slide, I can show you, that would be easier. It's in Leogan, this is Haiti,
Oh,
this is Haiti, Leogan is here,
okay.
30 kilometers from Port-au-Prince.
It was the epicenter of the.
Right.
That was the epicenter of the earthquake.
I have a question. You said you're the only bachelor program in the nursing, in nursing. Does that include also for all of us that are nursing students? We had to take a lot of prerequisites before we came in. Is that the same for your students within the curriculum, or are they taught the microbiology and anatomy and everything? within your school?
Absolutely, they have the.
That's part of the curriculum.
Yes, that's part of the curriculum. The first year is nothing but sciences. Because we don't really start until the second year to get into nursing.
Well, first, thank you for being with us today. It's very enlightening. Could you speak to scope of practice? What can the nurses do upon graduation? And is there something written?
Yeah.
You know, what are their parameters? And likewise, for now, you're going to have advanced practice nurses. And what do you call them? Are they called RNs?
We are the first FNP program in the country. There's no name for it yet. Like when they started NPs in this country, it's gonna be a struggle. We know it's not gonna be easy. The doctor's not gonna give up like this. But we're working, and the Minister of Health, she is a very pro nursing. So she's working. We need to have a legislature to have nursing in the French translation for nurse practitioner would be infirmière clinicienne. There's a name for it. But right now we can't call it in Haiti because it's not on the chart of Haiti. But it'll come. We're gonna fight until it comes because it is important, it is necessary.
Is there any relationship between FSIL and Project MediShare or Partners in Health? Because I know that they run some of the medical facilities.
Okay, MediShare is from University of Miami, and MediShare is way in Hash, and they have a hospital where we'll be going soon in February and March when students will be at Meuse, Hospital Meuse in Port-au-Prince. That's MediShare. Zami La Santé, that's what you call Partners in Health. Zami La Santé, they're in the plateau. They're near Hash, Cange, Mirbalais, that's where they are, more in the Artibonite. They're not in the area where we are.
Okay.
But we know.
But your students will go to
Yeah, they will be
the
going.
new hospital as soon as they take students, because they're an approved program.
Okay.
And, so how do you manage record keeping and so that you're better able to sort of serve the community and the people who come in, maybe not on a regular basis, maybe they can get there. So do you?
You're talking about patients?
The patients, yeah, patient information. How do you keep track of, if you are helping the community, there's no doubt, but people aren't coming in on a regular basis, or do you give appointments? I mean, how does that all work?
Well, first of all, that depends on where the patient goes. If you come in for a mission, what the thing that's being done, and that's why I'm calling it the Band-Aid, when you go, you see the patient, you give the record to the patient. That's one. You can't do that. So I'm advocating to have a center somewhere, patient would come, being seen by the team coming from the US, and the record is here at the healthcare center. If you go to Hôpital Sainte-Croix, the hospital we affiliated to, and the reason for the school is that hospital, they have record, and they're not kept the way they should have, but they have record. They have a medical record. Yeah. But for the other part, no. They just come, and one thing that kills me, every time I see they give the record to the patient, and then there's no continuity of care. Nobody knows what happened.
So clearly you're advocating for sustainable programs in Haiti, and there's already evidence of that with the school, and that those students have become faculty, and that's where the future's going. How do you see, as American students, American nursing students, and all programs for Haiti, how can we best help? Because clearly, as you said, putting a Band-Aid is not helpful, and it can be harmful. So how can we best help?
I'm looking at as a frank collaboration. First of all, let's say you come to Leogad, and with the school working together, have an agenda, have the record keeping, the way it should be done, identifying the area of great needs. Where are we going to do it? How are we going to do it? Like me, one of my thing is to see all Haitian students, children, immunized. I would like to see that happen, to vaccinate all children. So if we're going to take this as project, we're going to do it together. And then that would be the greatest gift to Haiti. Because by vaccinating all children, I don't know how the mortality, the morbidity rate will be decreased. Absolutely will be lower if we can vaccinate all children of Haiti. So, if we take the project, it's just working together with a common goal, giving good health to the people of Haiti.
So thank you so very much. Can we give her a huge round of applause? I know that Joanne wanted to make
I
another
just wanted
comment.
to make one additional statement. There are students from other schools of nursing across the country who are actually helping, either fundraising or, there's always things like uniforms, book resources, tuition that can be helpful. But a very exciting piece that I think from the University of Michigan, a community health faculty there, I know that's okay, is doing a collaborative in community health by Skype. So the students from FSIL meet weekly with the students from the University of Michigan in undergrad community health. And let me tell you, those stories are very different. A community health experience in Ann Arbor, Michigan is very different than a community experience in Leogane. And so everybody's impacted by that. It's not a one-way. And so there are exciting kinds of options and opportunities that can happen. Yeah.
And I have to say, the community health class, every Tuesday, Norma Saka is teaching her class in Ann Arbor, Michigan. The student in Leogane is in the class. In Leogane, they're in the class. They talk, they share ideas. We do it through video, and it is wonderful. And when they do assessment, community assessment at Ypsilanti, we do in community assessment in Leogane. And at the end, the problems are the same. The same thing. And community health care is the same everywhere. We just have to put our head together to look at it the same way. Be it developing countries or developed country, it's the same thing. The same thing, the way to deal with it is the same way. So, and at the end, that's what they found. Last year, they worked with tuberculosis. Well, naturally, the rate is not the same, but you have the same thing. The symptoms are the same, treating it is the same. The education of the community is the same thing. You got to tell them the same thing. Whether you're in Ypsilanti or in Leogane, you're going to tell them the same.
Well, thank you very much. We're going to